Okay, next one is the common extensor tendon. This is what you'd look for tennis elbow, just lateral epicondyle. You come across, and there you are. So what we're looking at here, if I can bring my cursor over, is here's the footprint. Here's the ulnar collateral ligament is going to attach basically here, take up about half this footprint, and the other half will be the common extensor tendon. And what you're looking for is you can have basically an enthesitis, so an issue, basically attachment to the bone. It can be thickened, hypoechoic tendon, which would be tendinosis, not tendinitis, tendinosis. Yeah, so what I also check is, and you can also palpate for this, but I would typically just take my transducer here, keep it in the same orientation I had last time, and then I would take it and scan through the muscles, and I would look for really deep, dark hypoechoic sections, which would indicate a myofascial trigger point. Next, let's look at the wrist for carpal tunnel syndrome. So what I can do is we'll basically just look for the nerve, and we'll measure the size of the nerve. If the cross-sectional area of the nerve is less than 9 millimeters squared, I figure what it is, 99% chance or 98% chance, they do not have carpal tunnel syndrome. They have something else. And you can have multiple things. So you could have the nerve compressed at the wrist, at pronator teres, thoracic outlet syndrome, under the clavicle. The nerves can be compressed multiple regions. Maybe you have nerve compression somewhere, plus referred pain from myofascial trigger points. I've solved a lot of people's carpal tunnel syndrome. Even people who've had the release, even successful release surgeries. Yeah, my pain went down 20%. They call this successful release. But yeah, this is the best way. This is better than nerve conduction studies for diagnosing carpal tunnel syndrome. All you have to do is basically measure the size of the nerve. So let's change the setting to nerve. It is, oh, shoot. And there it is. So the area is about 6 millimeters squared, which is less than 9 millimeters squared, so I do not have carpal tunnel syndrome. Woohoo! I will say that the Clarius is much easier for this. I can see the nerve right away. The only reason I can even find the nerve in the mess with this transducer is because of anisotropy. The nerve doesn't change as much as the tendons do.